In this video, we're going to talk about endocarditis. Endocarditis is inflammation of the endocardium. So the inner part of the heart is called the endocardium. Then you have the myocardium just outside that, and then like a fibrous connective tissue covering called the epicardium. So the endocardium is what we're talking about here, and inflammation of that endocardium, especially the valves. So the endocardium is covered by an epithelial tissue, a simple squamous epithelial tissue. So that's one single layer of little flat cells, and they secrete PGI2, prostaglandin I2, which is prostacyclin, and nitric oxide, and these will help kind of keep everything smooth and keep the blood going by it where no platelets stick to it. And it has an underlying connective tissue called areolar connective tissue. So this covers the whole inside part of the heart called the endocardium, and it's a simple squamous epithelial tissue with underlying areolar connective tissue. So that's there, it's protective, there's no issues there. So something has to happen to kind of rough up and get rid of that epithelial tissue and underlying connective tissue, where it's kind of taken off the surface of the valve, and then platelets can stick there because it's sticky once you get past that. And those platelets will stick to that area, and then fibrin will come in. They form something called non-bacterial thromboemboli. And so you start getting this kind of basically a blood clot starting to accumulate on that valve. And then with infectious endocarditis, which is by far the most common, you can also have non-infectious, but infectious is by far more common. Once you get that damage to the valve, and then you get that clot forming, if for some reason you get certain bacteria in your blood, bacteremia, those pathogens can actually go and infiltrate that little clot and start to cause vegetations, proliferate in there. Once you get them infiltrated in, they form these microbial vegetations. Then you start having the immune system kick in. So inflammation kicks in, and white blood cells will release cytokines like interleukin-1, interleukin-6, tumor necrosis factor. You get reactive oxygen species and proteases released as they're killing the bacteria there. And this spills over into the paravalvular tissue. And so you can get inflammation of the actual paravalvular tissue around the heart, and it can continue to extend out, cause an abscess that reaches like your AV node and SA node and cause like a bundle block or bradycardia. It can extend into the pericardium and cause pericarditis. So those are some complications as it kind of takes off. And so let's talk about the two primary pathogens that cause endocarditis. We can have an acute endocarditis. Acute just means these people are really sick. So they come in, the valves are getting destroyed so fast. As the bacteria and this inflammation happens, it just ulcerates and perforates and eats away at the valves. So the valves, when they close, they're not shutting all the way. So you get regurgitation of fluid, of blood. And as blood backs up, that means blood's not leaving the heart. So you get decreased stroke volume and cardiac output. That's going to decrease the perfusion to the body, and so that can lead to hypotension and cardiac arrest. So you have to be real careful with that. And then they come in with a really high fever. Their heart's just failing to get enough perfusion to the body. They can, upon auscultation, you can hear those murmurs. A lot of times it's on the left side of the heart because you have all the force is greater over there too, so it can rough up those valves even more. So you can get mitral valve regurgitation, aortic regurgitation. You hear these during the systolic phase of heart, between the S1 sound and the S2 sound, like you'll hear some kind of holosystolic murmur because you'll hear that backflow coming during that time. And so Staphylococcus aureus, these are virulent, so they're going to really cause problems. And then you can have subacute. These patients are a lot less sick. They come in and maybe they're fatigued. You can maybe detect a little bit of a murmur, maybe just some low-grade fever or something like that. And typically this one's called Streptococcus viridans, and this is part of the oral microbiome. And so if somebody has some kind of abnormal valve, this really predisposes them to growths. So I'll come back to where we find these, but let's say that you had strep throat and 2 weeks later you have all these antibodies, and through molecular mimicry they'll go to those valves and destroy the valves, or at least get that covering off of them, that epithelial tissue with underlying connective tissue, and kind of denude them, and then platelets start sticking, and then you can start having, if you have bacteria, they can definitely find that spot. So a history of infectious endocarditis, they've already kind of have these areas that are susceptible in their valves if they've had it before. Mitral valve prolapse, any kind of valve problem can rough up the valve and be attractive to platelets and bacteria. And prostatic valve, the prostatic valves, they don't have that epithelial tissue and underlying connective tissue producing prostacyclin and nitric oxide and all that, so they're just more susceptible to things sticking, platelets sticking, and then pathogens sticking, coming into that. So with Streptococcus viridans, this is in our oral microbiome. If you have this predisposition and you're a dentist, you want to know, you want to take a past medical history and find out if they have this stuff, because they need some kind of prophylactic antibiotic like amoxicillin or something, just to kind of make sure that when they have a dental procedure, even just a teeth cleaning or some kind of root canal or something, just making sure that the Streptococcus viridans that's escaping transiently into the blood aren't going straight to those valves and causing microbial vegetations. So that's the subacute. And then the bad one, the Staphylococcus aureus, this one's found on skin, so anything that's going through the skin kind of is at risk for taking some of the skin microflora with it. So a lot of IV drug users get this, and then just doing any kind of IV period or a catheter or a pacemaker. And this one's so virulent, it can even get to healthy valves. Sometimes just a healthy valve can get attacked by this bacteria. So that's something to be aware of as well. So another thing that can happen is that as you start getting these vegetations growing on there, they can break off and embolize. It's called septic emboli. And most of the time, it's on the left side of the heart. So a mitral valve septic embolus or aortic valve septic embolus can break off, and it's going to go into systemic circulation. It could go up to the brain and cause a stroke and an abscess in the brain. It could go over to the spleen and cause an abscess there. It could go to the kidneys and cause an infarct or abscess there. It could go back into the vertebrae of your spine and cause osteomyelitis. It could go into the disc, intervertebral disc, and cause discitis. It can go, it can go just about anywhere in the body and cause problems. It can go into the little capillaries in your fingers, in the hands. So that's a big complication. One thing to make note of, though, the IV drug users, a lot of times the pathway for that Staph aureus is going to stick to the tricuspid first. So with IV drug users, it's more common for the vegetations on the tricuspid. If you have a septic emboli, it's going to go up into the lungs from the right side of the heart. So it could cause a pulmonary embolus. It could cause abscess in the lungs. So that's something to be aware of too. So let's bring it all home and summarize kind of the steps that happen. You get some kind of damage to the valve. It kind of denudes that protective covering. And then you get platelets and fibrin come into the area and kind of forming a thrombus or a clot. That's called a non-bacterial thromboemboli. And then if you get bacteria in the blood, once this has already happened, certain bacteria can go and infiltrate this clot and then start to form vegetations within it. Once you get that going, then the immune system is going to kick in. Cytokines and reactive oxygen species and proteases are just going to cause inflammation and abscess around that area and on the valves and just kind of chew away and perforate the valves. So that's kind of the process of the pathogenesis and pathophysiology. So how would you diagnose this? First, you want to take their blood and get it cultured. You'd have to put them on some kind of empiric broad spectrum antibiotic first, just to maybe vancomycin with some kind of gram-negative coverage, because these are both gram-positive, but you can have some gram-negatives that can cause this. So you just kind of have to cover everything until you get those cultures back. And once you get the cultures back, then you can narrow it in to the specific pathogen. And then you also want to do an echocardiogram. So a transthoracic echocardiogram can pick up on the valves and see maybe some vegetation's growing on them. But to really see the extent of the inflammation, you have to do a transesophageal echocardiogram, where you swallow a camera, it goes in, and it can see the abscesses that the transthoracic echo can't pick up on. The inflammation, the extent of the inflammation, is it getting into the pericardium, is it getting into the AV node? You can really see the abscess as well with the transesophageal echo. And just wanted to make note, because it is very rare, but you can have a non-infectious endocarditis. A lot of times this is SLE, or systemic lupus erythematosus, and you get all those, it's an autoimmune disease. It's actually called Liebman-Sachs endocarditis, after the scientists and doctors that discovered it. But basically you get all these antibodies, and they can go and damage the valves, but you don't have the microbial growths. It's more of just this non-bacterial thromboemboli that form. But again, those can cause problems. Those can actually damage the valves too. They can embolize as well. Hypercoagulable states, something like factor V Leiden, something that just kind of causes more clotting than normal. Maybe the clots can stick to those valves better. So hope that video is a good overview of endocarditis, and I'll see you in the next one.